Marijuana is a term for cannabis that has a long history in the U.S. It originated in Mexico, and it was popularized kind of in the early 20th century by politicians as a way to kind of distance cannabis from its scientific and industrial uses and gain support for anti-cannabis legislation, which was happening at the time because there was a lot of concern about recreational cannabis, recreational marijuana use, and it really had racist connotations because there was also a lot of concern at the time about large-scale immigration from Mexico. So, as I said, really, when you read cannabis, marijuana, if you see those terms, they are considered interchangeable. I prefer to use the scientific term for the plant, which is cannabis. And one other term that I wanted to kind of define as we move forward that people may have heard, and that's hemp. Hemp is a term for strains of cannabis. It's not a different plant. It's a term for strains of cannabis that contain very, very low amounts of THC, which is that psychoactive chemical. And so those are three terms I think are important to define. So delta 9 THC is what we consider to be, when we say THC, a lot of times that's what we're referring to. That's the THC cannabinoid that exists in in the plant, and it's been the most studied cannabinoid of the evidence that we have. Delta 8 THC and delta 10 THC, these are compounds that have become popular in gas stations and places like that because they can be derived from CBD that comes from hemp, that is produced legally in accordance with the 2018 Farm Bill. And so but this delta 8 THC and is not it doesn't exist naturally in except maybe in trace amounts in the plant itself, and it has to be synthesized from THC. And so that process, you can end up with a lot of byproducts. It's unregulated, so it's unclear how safe it is or what's actually if what is marketed is what's actually in these products. And I know that is the issue of delta 8 THC and hemp-derived cannabinoids is a very complicated issue with a lot of discussion. So I'll start by just, saying that yes, the THC potency has been increasing, and that THC, does seem to be increasing. THC potency is associated with, potential negative effects, increasing ER visits for things like acute psychotic episodes related to THC, things like cyclic vomiting syndromes that land people in the hospital with electrolyte imbalances, increased risk of cannabis use disorder. And so these are all things that are associated with this particular cannabinoid that has these psychoactive effects. And so that's why just a little bit of background, that's why there is this question about, do we need to put a limit on THC concentrations? So a consideration for having either higher caps or no caps in the medical system would be that if someone is using cannabinoids or cannabis for medical purposes, that lower THC caps on specific products would increase the burden of product necessary to reach a desired effect. And so, but again, there's need more, research and evidence to really explore these issues and determine what's the, reality, behind those concerns.